Hello again. We are back today to talk about how to set up chest tubes. So when you get a chest tube out of the supply closet, this is what it looks like. It says Oasis dry suction water seal chest drain. And then you'll find it in our ER storage closet. You find it on the back wall over where your chest tube, or not your chest tubes, but your central lines are, and you're next to your splinting supplies. So I already have one open. So this is what it looks like when it comes out of the package. And as you can see, it has all this big tubing, and I dropped my water. So when you take it out, to set it up, you want to turn this thing on the bottom because you want to sit your feet up, because if you don't sit it up, it's going to fall over, right? The other thing you want to do, this is what your water typically comes in, or something similar. You want to take this off. And this blue tube on top, it usually will have some sort of like cap or something on it. You want to take that off. You want to peel that off, and you want to put it right in that hole, okay? That will fill up the water down here, okay? Should fill it up to about this 2 centimeter mark. Once you have done that, you want to pull your handles out of the top of the chest tube. And you can hang it on the side of the bed this way, okay? We're not gonna hang it here. This is just for demonstration purposes. If you decide not to use your hangers and you wanna put it on the floor, that's fine, but tape it to the floor so that it doesn't get kicked over, knocked over, anything like that. Now when it comes to hooking up your chest tube, from a nurse's aspect, we don't do a whole lot. We will literally pull this piece off and hand it to the doc, or help the doc plug it into the actual chest tube, okay? That's pretty much what we do with it. The next thing we're gonna do is we're gonna get our suction tubing. So you have your suction tubing, right? Take your suction tubing, we wanna hook it into the water port right there, and we wanna hook it up to our suction up here, okay? And then you turn on your suction, whatever the doc says to set it at. A couple of things with this. This dial here, let me get closer. This dial here with the orange thing, it should be set at 20. If it's set at 0 or anything other than 20 when you get it out of the package, there is this little dial right here, and you just turn it until you get it to the 20. Okay? Pretty straightforward. Once you hook your suction up and you set it to whatever the doc says, which is typically above 80, then you want to check it for leaks. You also, and how we're going to talk about that in a second, but you don't want your side rail up. No, we're stuck. With your chest tube hanging over it like this. It should be down here. Or if you put your chest tube at the foot of the bed for whatever reason, you want it down on the side. You just don't want it hanging over the top. So we're gonna make sure we don't have any loops. And then we'll make sure that it's sitting right here, connected to the chest tube, right? Now, one of these things with these chest tubes is it should not be bubbling. If this water is bubbling in here, that means you have a leak, and you need to figure out, are you not sealed correctly, or is it coming from the chest tube itself? One of the ways you can ensure that there is no leak is once you hook it up to the chest tube, you take this, you take silk tape, you want to get you a piece of tape, and we'll say this is my suction tube, the chest tube that we're hooking it up to, right? You want to run a piece of tape long ways, like this, and firm it down. And make sure that you have a little window here, because if it gets clogged with blood or gunk, you can see that there's a clog, so you know you need to change it out, okay? The other thing with the chest tube is you want to make sure that every shift you are signing off the amount of drainage. You can use a piece of tape, you know, wherever the drainage is at the end of your shift. So if you're at 30 cc's at the end of your shift, you can put a piece of tape with your initials and the date, and you want to make sure that you document that in Epic, all right? If you have any other questions, you can ask me or you can ask one of your UBEs. Thanks for watching.